Hi everyone, Abdelrahmen Ali here. Welcome to our GCOS 2026 preview series. Over the next few weeks, we will be chatting with the speakers shaping this year's program in VCU. And to kick things off, I'm joined by someone who really needs no introduction in the cardio-oncology world. I have Dr. Alexander Lyon today. Dr. Alexander Lyon is a consultant cardiologist at the Royal Brompton Hospital in London, where he has led the cardio-oncology service since 2011. He directs the Cardio-Oncology Center of Excellence, awarded the gold status by ICOS in 2021, and he chaired the first ESC guidelines on cardio-oncology. He's the executive board member of ICOS and immediate past chair of the ESC Council of Cardio-Oncology and the past president of British Cardio-Oncology Society. And he's also current deputy editor of the European Heart Journal. With over more than 270 publications and co-PI roles in the Cardiology Oncology Network and the EU Horizons Compass Network, is truly one of the leading of the field's leading voices. Please join me in welcome Dr. Alexander Lyon.
Thank you, Abdelrahmen.
Thanks so much for being with us today. So you have led the Royal Brompton Cardio-Oncology Service since 2011. When you walk into GCOS now, how does it feel compared to those early days?
Well, that's a great question. I think if I take myself back to 2011, it's like planting an acorn in a field and hoping that you'll get one oak tree grow from it. And actually, what we've seen is not a tree, but a forest, an explosion of cardio-oncology over the last 16 years. So now, compared to those early meetings when there might have been 30 or 50 of us, now we're expecting 300, 400, 500 people at these large cardio-oncology meetings. And we've seen an evolution in how GCOS has developed over the years. I had the privilege to host GCOS in London in 2017, and we had just over 300 delegates from 32 countries, whereas in America, in Minnesota, Cape Town, and before that Madrid, we've just seen a massive growth now with people coming from over 50, 60, 70 countries around the world. So it really is a global specialty that we're needing to deliver as cancer treatments have really evolved in the last 20, 30 years. This is a great, good news story that people are now surviving cancer, living much longer. Many people with cancer controlled as a chronic disease, but we need to ensure they have their cancer treatment safely and in particular don't get collateral damage of heart failure or vascular disease.
Completely agree. It's amazing to see how the field grew, over the last decade or so. I guess moving to the next question, you're going to be co-chairing one of the sessions, joint session between the European Society of Cardiology and ICOS at the upcoming GCOS. Without sharing too much, what would like us to know about this session and why we should be anticipating this session?
Yes, so this is a great session, which is a collaboration between the European Society of Cardiology, Council on Cardio-Oncology, and ICOS, and it's called Global Cardio-Oncology. Experiences shared from around the world, and we're going to have speakers coming from all corners of the world, from South America, from Japan, India, Australia, and Europe. And we're going to discuss the similarities and common themes of cardio-oncology services in those countries, but also the differences, the different challenges, access to cancer treatments, that varies, access to modern cardiology care, modern cardiac imaging, biomarkers, treatments, and that does vary. And then the scale of different countries and the tsunami of cancer patients and survivors that we're now seeing. So hopefully we can learn from each other and take these experiences that we hear from colleagues and take them back to our own hospitals and clinics to improve our services.
Definitely looking forward to that. So for early career cardiologists thinking about cardio-oncology as a path and maybe will be joining us at GCOS, what would you advise them?
So there's going to be a lot of opportunities for the young trainees to learn about cardio-oncology. I think one thing is to go and learn, if you're a cardiology trainee, is learning about oncology. And this is challenging. One place I tell my fellows to start is the New England Journal of Medicine, because every few weeks there's new randomized controlled trials. And as well as looking at the benefit of the treatment, go to the adverse events table and see what the cardiovascular toxicities. They may be predictable if it's a known treatment with cardiac problems such as VEGF tyrosine kinase inhibitors, but it might be new. And that's one area we can learn. And then applying for fellowships. So lots of the main specialist cardio-oncology centres, and in particular those with the ICOS accreditation as centres of excellence, opportunity. We currently host 4 fellows from different countries around the world who come to London to learn about cardio-oncology, and I know colleagues across Europe, America, Canada, Brazil, Australia all run fellowship programs. So when you come to GCOS, you can have an opportunity to meet with us, speak to our fellows who are attending and hear their experiences, but also come and speak to us if you're interested in developing your program. And what I'd recommend is visiting the ICOS website, because the ICOS website's got details of where all the centres of excellence are around the world. So you can then see the centre that's close to you and maybe suitable for you.
Thank you so much for your time. I'm looking forward to meet you in GCOS 2026. For everyone, stay tuned for more interviews.
Thank you, Abdelrahmen, and see you in Williamsburg.